Electroconvulsive or shock therapy has long been a controversial treatment, but research shows that a newer, less invasive form of electrically stimulating the brain may help cure some psychological conditions, even something like bulimia. So a study was done at King's College London. 39 people who suffered from disorders underwent a procedure called transcranial direct current stimulation. That's a mouthful, but what they did is they used electrodes placed on the head to stimulate targeted brain regions. Bulimic urges reduced by 31% through this therapy. These results were then compared with people given a placebo treatment. And Dr. Domenick Sportelli, psychiatrist, joins us. Dr. Sportelli, how this exactly works as opposed to the more, how shall we put it, primitive electroconvulsive therapy?
Great question. So first and foremost, it's important to understand that the brain is an electrical organ. It's an electrical organ. Our neurons and our brain cells communicate with each other through electricity. It's absolutely fascinating. And we have mapped the brain by stimulating little areas of the brain. And by stimulating little areas of the brain, we can cause complex emotions to take place, memories, we can bring memories back, we can, of course, motor and movement. So based on that, we know that if we can stimulate very small parts of the brain safely, we can change behavior. Now with this particular study, it was a small study, very, very exciting nonetheless. There's an area of the brain, here comes a mouthful, dorsolateral prefrontal cortex. Try saying that 5 times fast, right? I could basically say right here, okay? It's a stimulant, it's a stimulation actually that goes through the skin, through the skull, but it's non-invasive.
In other words, you're not seeing the patient convulsions?
No convulsions. It does not elicit a seizure, so the patient is awake. It's painless, just feels like a little tap. But the amazing thing is this, the dorsofrontal prelateral cortex, here's that crazy word again, is part of the brain that's involved in the reward circuitry of the brain. And it gives a sense of reward and satiety and satisfaction. So people that have bulimia, they have an urge and a desire to binge and purge. When you activate this part of the brain, it reduces that desire and that urge, which is absolutely fascinating. Bulimia, anorexia, the eating disorders, from a psychiatric, from a medical perspective, are so dangerous.
Well, and I couldn't believe the statistic.
So dangerous and difficult to treat.
4.7 million females, 1.5 million males will experience bulimia. But what I find interesting and intriguing about this is when you're talking about that reward pathway, how many other addictions, psychological conditions are based in that area? So is this something that you expect in your field to be used more and more for not just bulimia, but other
Oh, I got to tell you, as these studies increase and as we see better numbers and more population treatment, I think that this has amazing implications. So I'm cautiously optimistic because it's a preliminary study and it's very new. So right now, the FDA has approved various devices that are transcranial. So we have something called magnetic transcranial therapy that has been known to help with depression and migraines. We have deep brain stimulation where you can actually go into the brain and help people with Tourette's, obsessive compulsive disorder, Parkinson's disease. So again, by activating areas of the brain with electricity, we can change behavior.
Word of caution though, and this is important because we've profiled these on the show before. There are some over-the-counter devices that claim to do all these things. We've put a few to the test. Is it fair to say be cautious in terms of just going to the store, putting one of these hats on, and it's doing something, but is it targeting the right area of the brain?
Absolutely. You have to understand that these are areas of the brain that are mapped by neurology and neurosurgery, and they're very, very specific energy settings and very specific areas of the brain that they're targeting. So I have seen those too, and it's a little bit troubling.
Yeah, you just have to be careful with new treatments like this. Thank you so much for your perspective.
Good stuff.
More to come, everyone.